So this screencast is going to cover why communication skills are so important in healthcare. And what I'm going to be presenting to you is some of the policy and guidance which relates to that. So what I'd like you to do is watch the screencast, make a note of keywords that appear that you think, oh yeah, that relates to my communication skills. And think about how your communication skills are going to relate to you as a practitioner. What are they going to do for your practice? What's going to make you a good communicator, a good practitioner? And we're going to discuss these at the beginning of the session that we're going to have together. So let's start thinking a little bit about policy and guidance. And I'm going back on some of this and bringing up to current stuff as well. But this is all about what enforces good communication in the working environment. And what I want you to see here is this is about relationships, but it's about team working. So it's not just to do with patients and carers, but it's also to do with your colleagues and the other people that you work with. So it's holistically, it's all about your working environment, not just patients. This is just going to give you a very brief overview. But there's plenty of references to go back to if you want to look at this any further. I'm just directing you to bits and pieces because these documents are all long things and there's no way you're going to read through them all. This aspect, no decision about me without me, comes from liberating the NHS and giving greater choice and control. That was a Department of Health document. And you'll see a lot of those same kind of comments going through a lot of the different documentation. So in some ways, this is quite a consistent aspect of healthcare over the last 10 to 15 years. So lots of similar statements. And the second one here is about the NICE guidance for adult services. And here it's saying, treat the patient as an individual. Treat patients with respect, kindness, dignity, compassion, understanding, courtesy, and honesty. And then make sure that your approach is individualized. So it's tailored to the patient's needs and circumstances. So very much core to how we work, very consistent approaches. Also going back to 2010, one of the first documents that talks specifically about your communication skills, and it's called the Essence of Care Benchmarks for Communication. And note that skills are clearly with patients and staff. So all staff are going to demonstrate effective interpersonal skills. So you're going to get along with people, you're going to be friendly, you're going to be welcoming, you're going to have good interactions with other people. So you communicate fully and effectively with each other. And with patients and carers, you're going to be encouraging them to communicate their needs and preferences at all times. So it's all about trying to make sure that the communication we have supports person-centered care. If you look at the second one, this is about behaviour change, individual approaches to behaviour change. And this document has been reviewed in 2019, but not revised, not changed, because it wasn't felt there was enough worthy of new evidence that was going to change it. So here again, you've got tailoring interventions to meet the participants' needs, adopting a person-centered approach. When we're making plans for people, we're not doing them in isolation. We're not doing plans for people. We're doing them with them. Communicating effectively when we give information and providing the appropriate information, and we're going to be listening and knowing how to demonstrate empathy. And we're going to be able to build rapport and maintain that rapport, which is harder than just building it, and building relationships with our service users. So if you think of how you might like to work as a professional, you're going to have an ongoing relationship with your service users or patients. So it's really important that we have those kind of focal points going forward. So more recently, NHS Health Education England, a person-centered approach framework. And I think this has had a really important impact. It's quite a big framework, but a little less lengthy than some of the others. And what that's saying is building on what we already knew. Patients and the public should be actively involved in all decisions and treatments that affect them and are offered informed choices that empower and place them at the centre of the care. So if you're a patient and you are having an interaction with a healthcare professional, they should be able to say to you, well, actually, these are the options. What's going to work best for you? And sometimes people will decide, actually, the best option for me is not to have any treatment. And that's something that we have to learn to work with and accept. So, but we need to be able to give people information or offer that information so that when they make a choice, they're making a choice that is the right one for them. So there's quite a lot going on with this about making those opportunities for people to be able to make the choice that's right for them. So if you're going to do that, what it's saying is your core part to that is your communication and relationship building. There's that rapport again. And about having conversations that are two-way conversations. We're engaging with people. We're enabling people to make change and we're supporting people in the decisions that they make. So really important framework that influences how we work as professionals. So you've got just a few of the many NHS and nice guidance that are out there, but some key ones that are actually going to say, this is how we need you to work. So these aren't dietetic specific, these are healthcare specific. But let's move on to look a little bit about dietetic specific. So this is from the new Standards of Proficiency from the Health and Care Professions Council that came out in September 2023. And this is some part of what it says about communication. You'll notice I've missed some of the other aspects out. So these are the people that send out the standards for behaviour and practice for all healthcare professions, including dietitians. But each of these policy and guidance documents are profession specific. So they're very similar to other healthcare professions, but these are the ones that are dietetic specific. And you'll also see that they link with the standards of conduct, performance and ethics, which are due to moving throughout this year. So we're going to use effective and appropriate verbal and non-verbal skills. And that's some of what we're going to learn in our session. And this is, again, you see it's communicating with service users, carers, colleagues, and others. So not just something that you use when you're in a consultation with a patient. We've got to understand the consequences of our communication. And this is something that's slightly different, with a big emphasis on equality, diversity and inclusion in the new standards of proficiency. Knowing how our communication might be affected by differences, including protective characteristics, other experiences and cultural differences. So we've got to be mindful of the differences between ourselves and the people that we are working with that may mean that our communication can be interpreted differently. So we've really got to be thinking about that. We've got to be working on preferred roles in decision making. So that service user in front of you, how involved do they want to be in their decision making? How much do they want to take control of that consultation and make sure that it's meeting their needs? And we may have to modify our own means of communication. We can't expect our service users to modify theirs. We've got to work around the differences in communication. And wherever possible, where it's in our control, is to remove any barriers to communication that are there. And we've kind of got to also think with our service users, what information do they need? What format does that information need to be in? How can we make it possible for them to make informed choices? So there's a lot of information there about the onus being on ourselves to take a lead on trying to break down barriers to communication and to facilitate good communication. The BDA, comes from the curriculum framework for pre-registration training for dietitians. So all of the universities that teach dietetics courses have to meet this framework, all of the aspects of the framework. And that is something that the BDA check, and that's how you get to be a validated course through the BDA check-in or accredited course. They check that there is room in that curriculum for everything that they believe that a dietitian should have when they graduate. So here, what are they saying? We need competent, autonomous, safe and compassionate practitioners who utilise current state of knowledge. So we all know we have to be up to date with our knowledge, but in order to provide outstanding, holistic, person-centred care and support. So it's not just making sure that you've got the most up-to-date guidance on renal disease, but that you can deliver that information in a way that is person-centred and you're supporting your patient to make the dietary changes that are going to be most relevant to them. So we are going to be dietitians who improve nutritional health and well-being in a holistic manner. We are going to empower the people that we work with, and whether that's an individual, community or group, to make the best informed choices. And we're going to be able to look at our communication and use a range of ways of communicating with people, with active listening, facilitating, for example, in groups, establishing our rapport and being observant so that we interpret the non-verbal cues coming from our service users and can act on those. And then you'll see that we're going to be applying basic behaviour change and behaviour modification techniques. So we're going to support people to identify barriers. We're going to try and identify these barriers and develop strategies to overcome barriers to communication and to behaviour change. So this is very consistent with what you would have seen with the standards of proficiency, and that's how it should be. They may be coming from different organisations, but they are basically heading for the same guidance. So the Code of Professional Conduct, which is relevant for you as students. So it starts the minute you're a student. And here you're going to see very similar things. Respecting individuals' needs, their values, their culture. So all links very much with that EDI agenda that we get from the Health and Care Professions Councils. We respect the rights of individuals to make informed choices. We treat people with compassion, empathy, all the same kind of words that you've seen coming through. And we communicate appropriately and effectively with our service users and colleagues. And what I really want you to note here is that it's required. This isn't an optional extra, this Code of Professional Conduct. It's required. You have an obligation, as do I, to adhere to the standards within that code. It's not an optional extra. And finally, this is just a very brief point about some of the dietetic evidence. What do we know about patients' views of consultations? And I've given you a couple of papers here and providing what patients want. They want good communication, they want to build rapport, relationship, and they expect their care to be individualised. They want patient-centred care that can be patient-led, so they're taking control. Or sometimes people say, actually, I want you to lead on this and tell me what to do. It's not usually the best way, but that's what, people have a right to ask for that. And the other thing I want you to be noting of that is when communication is not good, there's disagreement, and the patient may go away with a completely different understanding of what a consultation included. And if you don't build rapport, you don't understand feelings and concerns, and you end up with patients who are a lot less satisfied with their consultations.